Welcome, everyone, to our virtual audience members from across the globe. My name is Dr. Vanessa Carey. I am a physician and I lead Seed Global Health, an organization dedicated to training, scaling, and supporting the health workforce. I would like to thank our partners for this event, the Access Challenge and the One by One Target COVID-19 campaign, as well as all of our participating dignitaries, healthcare workers, and policymakers who are joining us this morning, this afternoon, this evening, wherever you are. I would also like to take a short moment to recognize the efforts of the One by One Target COVID-19 campaign in partnership with the Africa CDC and with the support of the Rockefeller Foundation and the WHO Regional Office for Africa. They are working together tirelessly to combat the spread of misinformation as a means to mitigate the deadly spread of COVID. Dr. Ahmed, Deputy Director of the Africa CDC, who has helped spearhead this effort, is here with us today, and we are deeply privileged that we will be able to hear from him. While access to vaccines remains a critical barrier around the world, we must also ensure that everyone has the information they need to protect themselves, and that when vaccines are available, that they will be taken. And an aim of this particular campaign is to build a network of trusted health messengers, which are composed of our Africa COVID champions, including some of the most prominent African celebrities, media personalities, health providers, journalists, athletes, entertainment, business, cultural, and faith communities. These influencers have committed to serve as powerful public health advocates who will help the Africa CDC to reach people with the essential information needed to fight the COVID-19 pandemic and to help save lives. Collectively today, we have brought together global health leaders from across the spectrum of health systems, government, advocacy, and the private sector. The breadth of participants and audience members just goes to show how deeply our global community cares about what's happening today in this pandemic and for our health workforce. The health workforce that has been a common thread of hope, bravery, and protection. And also how our global community seeks to protect that workforce and all of our communities against the still present and evolving coronavirus. We are more than 1 year into this pandemic. And while the experience has varied greatly across countries, regions, and local communities, COVID has profoundly demonstrated deep-seated inequities that have actually existed for years, but continue to play out in more exposed but perpetually painful ways. Inequity is the driving narrative around access and distribution of our only principal intervention to fight COVID at this time, which is vaccines. And unfairly and unjustly, these continued inequities are driving preventable death and suffering for millions of people around the world. Beyond access, though, and one of the things we're going to talk about today, and for many reasons, vaccine hesitancy is at its height, led by misinformation and disinformation that ends up feeding this revolving cycle of fear and distrust. Vaccine production and delivery plans are only useful if people are going to be willing to be immunized. So we're fighting across all fronts in this moment. I'm a physician. And as a physician who has been working on the front lines of COVID this last year, I know firsthand the dangers the health community has faced. And I have deep respect for my peers around the world who have provided care with courage, compassion, and dignity, and many without the resources they have needed and deserve. But it has compelled me even harder through my work at Seed Global Health and all the work that I do to ensure that the health community has the appropriate investment, protection, and stability far beyond just this pandemic, when COVID is eventually and hopefully a virus of the past. According to Amnesty International, we have already lost more than 17,000 healthcare workers this last year due to the pandemic. That is 1 every 30 minutes. We cannot afford to lose further lives, talent, skills, or investment that is years in the making of an already depleted frontline. I am delighted, though, to have allies in this effort. I would like to take this opportunity to introduce our keynote speaker, a leader who I have grown to admire and respect over the last few years as I've gotten to know him, his work, his vision. His Excellency, Dr. Mohamed Julde Jalla, is the current Vice President of the Republic of Sierra Leone. He holds a PhD in political science from the University of Bordeaux in France. And before the 2018 elections, His Excellency was the Sahel advisor to the Special Representative of the Secretary General of the UN for West Africa and the Sahel. In that capacity, he co-led the elaboration of the UN strategy on the Sahel and worked closely with the peace and security architecture for ECOWAS, and later the G5, Sahel, and several international NGOs active in security and governance issues. His Excellency has spent most of his life promoting good governance and security in West Africa, and in his current capacity, he is keen to serve the people of Sierra Leone and ensure that Sierra Leone can catalyze sustainable and transformative development. Ladies and gentlemen, it is my pleasure to introduce the Vice President of Sierra Leone, His Excellency.
Thank you very much. Distinguished ladies and gentlemen, first I would like to offer my gratitude to Dr. Vanessa Carey for the kind introduction, as well as to Seed Global Health, the Access Challenge, and the One by One Target COVID-19 campaign, who no doubt continue to support the fight against COVID-19 across the continent of Africa. Distinguished ladies and gentlemen, it is for me personally an honor to be part of this event, particularly within the context of the 74th World Health Assembly. This event highlights experienced voices, the deep challenges we are tackling, and the opportunities we are championing as the world continues to face unprecedented and preventable deaths and suffering from the COVID-19 pandemic, both directly and indirectly, and as our health workforce continues to selflessly protect health and our communities. For my country, Sierra Leone, we know deeply the impact of health challenges on the population and the devastation they can bring. Today, in 2021, a time of advancement and innovation, we still face daunting challenges in maternal and child health, malaria, nutrition, and other preventable diseases. Indeed, a recent assessment in Sierra Leone just confirmed that poor health is the second largest constraint to economic growth in this country. We know that our future lies in better health outcomes and in making the necessary investments required to see those outcomes, whether more sustained financing of health systems, investment in infrastructure, or scaling of the health workforce. Today, distinguished ladies and gentlemen, we are challenged by the unprecedented scale of a global pandemic. COVID-19 has not only directly threatened our lives, economies, and well-being in the past year, but it has also threatened our future as well if we do not fundamentally change how we do business, both in health investment and how we create health equity, starting with the vaccines for all. Distinguished ladies and gentlemen, I think we can all agree that at the front line of this response, including in Sierra Leone, for example, has been the health workforce. They have been asked not only to serve as soldiers against an invincible, dangerous virus, but have done so in the most challenging of circumstances. They have responded not only to the pandemic and care for the incredible influx of extremely ill patients, but also to help us keep afloat all essential services that remain an ongoing need outside of COVID-19. Indeed, over 1 year into the pandemic, the World Health Organization reported that 90% of countries face disruptions to essential services, and Sierra Leone is no exception. The primary causes of these disruptions, it turns out, are reported in the health workforce, including from redeployment, burnout, illness, and death. For countries like Sierra Leone, where the health system is already overstretched and our health workforce faces grim shortages, COVID-19 has the potential to become catastrophic if we do not accelerate progress in responding to the pandemic. We sadly know this story too well, because in Sierra Leone, we saw the cost of delayed response during the Ebola outbreak. It is estimated that up to 9% of the health workforce were lost due to Ebola. We cannot allow at this stage for history to repeat itself today. Yet, Amnesty International has reported that the world has lost 17,000 health workers due to COVID-19. One every 30 minutes since the pandemic started. For countries like Sierra Leone, where we are already facing shortages of health workforce, these additional deaths are unacceptable. As a country, we are already committed to expanding our investment in healthcare and to ensuring we save the lives of our citizens from preventable deaths, whether COVID-19 or in childbirth. To do so, however, we need to be able to protect our workforce and our citizens. The global community and public health experts alike are rightly focused on the COVID-19 vaccines as the primary intervention to stabilize an already tragic situation and avoid further death, suffering, and instability. But the playing field is not equal, and access to enough vaccines for many countries, including Sierra Leone, our neighbors, and the continent remains out of reach. Distinguished ladies and gentlemen, in order for us to reach our continental goal of vaccinating up to 60% of all Africans by 2022, we must first have access to vaccines. According to the World Health Organization, achieving that goal will require an additional 1.5 billion vaccine doses for Africa if the two-shot AstraZeneca vaccine continues to be widely used in Africa. Africa hosts 16% of the world's population, but as was recently reported by the WHO, we have received less than 2% of the COVID-19 vaccine doses administered around the world. Sierra Leone, like our neighbors, cannot afford to lose another citizen to an infectious outbreak, and therefore we call on the world to help us prevent history from repeating itself. We can and must determine a more equitable and effective global distribution strategy that protects the most vulnerable. I believe, like most other people across the world, that no one is safe until we are all safe. As Vice President, I also have the humility to recognize where we need to do additional work in Sierra Leone. We must understand why people, Africans, Sierra Leoneans, are also hesitating to receive their shot when they are able to get one. We have listened to our communities, some of whom express deep concerns for their safety and deep mistrust with the system at large, the Western science community, and transparently their government. We must remember, though, that these are the same communities that faced the devastating loss and suffering during the Ebola pandemic. They see the currently mild state of the COVID-19 pandemic in our country, and they don't feel the urgency of response. The Africa CDC published this year an important vaccine perception study across 15 countries in Africa. This study sought to determine if people are willing to take the COVID-19 vaccines when made available, the reasons why they may be unwilling to do so as well. Over half of these people consider themselves either not very well or not at all informed about vaccine development. 60% of those who reject vaccines believe that it will not be safe. We all have a part to play in helping to build confidence in health systems and vaccines. Drawing from the Sierra Leonean experience, one critical way I personally think to address vaccine resistance is to link current interventions to long-term investment in healthcare systems, including its workforce. When people see an integrated approach to fighting COVID that takes into consideration the future of primary healthcare, that focuses on maternal and child health, it will no doubt rekindle their confidence in our fight against the pandemic. Response and building resilient healthcare system should be seen to go hand in hand. The health force will be re-energized. People will flock to once deserted health centers. Equally, I want to state here that Africa has got a long experience of vaccination over the years. Every parent, every mother, and every father in Africa knows about vaccine. The barrier we face is access to enough vaccines, coupled with how do we scale at speed across a hesitant community in the face of a new scourge. We can tackle this too. We can join forces with fellow governments, multilaterals, civil society, and influential public figures to invest in global communication interventions that can be contextualized and localized within our communities, as we have seen with the One by One Target COVID-19 campaign. We must expand, educate, and empower our health workforce as trusted messengers to serve as the bridge from government to the general public. We must protect these health workers and prioritize their uptake of COVID-19 vaccines along with the high-risk population. At this stage, I must say with all sincerity that this pandemic has not only challenged and tested our healthcare systems, including those of advanced economies, it has also tested the strength and the relevance of global solidarity and innovation. At the outset, vaccine availability was a challenge, and today we are grappling with vaccine resistance and vaccine solidarity. No single nation will feel safe enough until we invest in approaches that reinforces global solidarity in the fight against COVID-19. Therefore, distinguished ladies and gentlemen, this unprecedented and complex moment calls for a dynamic, holistic approach that invests in an ambitious COVID-19 response based on science, urgency, transparency, and ambition to defeat this pandemic through new collaborations and global solidarity so we can protect all our communities. It is in this ambitious spirit that I now declare the event open and look forward to fruitful and innovative deliberations. I thank you very much.
Thank you very much, Your Excellency, for your personal and powerful words to help launch this event. It set an incredibly important foundation for the things that we need to discuss today. And I'm incredibly grateful for your participation and really for your outlining the vision. I would next like, though, to introduce another important partner for all of us, the Honorable Minister, Dr. Joyce Mariko Kuduku, Minister of State for Primary Care in the Ministry of Health in Uganda. Dr. Joyce is a Ugandan pediatrician, academic, and politician. Serving as the Minister of State for Primary Care in the Ugandan cabinet, she was appointed to the position in 2016 and has since served as the elected member of parliament for the Moyo District Women's Representative in the 10th Parliament. She is a graduate of the Umbarara University School of Medicine, where she studied human medicine, graduating with a Bachelor of Medicine and a Bachelor of Surgery back in 2002. She then entered Makerere University of Medicine in Mulago, obtaining her Master's of Medicine in Pediatrics. And she has served, after getting her PhD in neuroscience, she has served as a clinician, as an educator, and as an advocate for her health system in Uganda. And we welcome Dr. Joyce this morning.
I thank you, Dr. Kerry, for that warm introduction, and thank you, Your Excellency, the Vice President, for your opening remarks, reflections, and providing the context of what we too are experiencing across borders here in Uganda. On behalf of the Ministry of Health and on behalf of Government of Uganda, I take this opportunity to welcome you all to this very event on the sidelines of the 74th World Health Assembly. It is my great honor to serve the people of Uganda and to provide directions and policy oversight for the country's primary healthcare system to ensure Ugandans have access to the essential services they need. In Uganda, we have experienced COVID-19 outbreak last year in March 2020. Our government responded quickly to enact protective measures in our communities and to prepare our health system. The President of the Republic of Uganda made a firm decision with the clear directives for the citizens of Uganda to follow. To prevent community transmissions, we closed all schools, we banned all large gatherings, we reduced vehicles movement to and from, we enforced an overnight curfew, and we made face masks mandatory. And in October 2020, we launched the community engagement strategy, which served to mobilize professionals and volunteers to inform the communities with public health guidance and to conduct contact tracing. We created COVID isolation facilities across the country, and we instituted a robust surveillance system across our borders. Last year, because of all this intervention, Uganda was a regional leader in prevention of COVID-19 transmission. To date, the situation continued to unfold. The virus continues to find cracks in our defenses, and we face real challenges in protecting our citizens and in keeping especially our frontline healthcare workers safe. While vaccine supply is a challenge, vaccine hesitancy and misinformation are a critical barrier in fighting the pandemic. I have listened to our citizens' concern, including those from our healthcare workers. This presents not only a lack of protection for the people of Uganda, but we know that any low uptake of COVID vaccination countrywide could prolong the pandemic, undermining vaccination effort in any other countries and on other continents by allowing the virus to spread and mutate. With a slow rollout and hesitations comes great risk to our health workers, who are not only treated COVID patients, but who are trying to continue to keep the rest of health systems stable. I am a physician by training and know that we need to maintain all the healthcare services, including maternal, child health services, infectious disease response, and care for the non-communicable diseases. We will only make progress against these priorities if our communities and populations trust the healthcare system we have and the healthcare workers who are delivering these services. Our health workforce was in a dire shortage before COVID, and without protection for our physicians, nurses, and midwives, the pandemic could threaten the community. I thank you so much for having me, and I look forward to continuing to support SEED Global Health, the Access Challenge, and a one-by-one target COVID-19 campaign in a mutual quest to beat the pandemic. Thank you.
Thank you. It's a pleasure and honor to be here today and moderate this discussion with an amazing panel of health professionals on protecting, investing, and addressing vaccine hesitancy challenges. My name is Irene Atuhaire. I'm the Deputy Country Director for SID Global Health in Uganda. I would like to introduce the panel we have today. We have Dr. Annette Alenyo, an emergency physician, the first female emergency physician in Uganda. She is the technical advisor for emergency medical services at the Ministry of Health. She's also the president for the African Federation of Emergency Medicine. Thank you, Dr. Annette, for being here. We have Ms. Harriet Naiga, who is a midwife and director for the Midwife-led Community Transformation Initiative. She is a young midwife leader with the International Confederation of Midwives. Harriet, pleased to have you here. We have Dr. Samson Radenyi, who is the Chief of Party for Ingobi project in Rwanda. He has over 20 years of experience in developing and implementing multi-sectoral projects in over 10 African nations. He's experiencing some challenges, so we appreciate his efforts of being here. And in case he's unable to join us, please know that he's with us. Thank you so much, our panel, and I look forward to this discussion. I would like to start right away with Dr. Annette. Dr. Annette, as an emergency physician, we know that the emergency department is the first line of contact for all of us with the health facilities. So from your experience and that of your colleagues, what has it been like for you at the front line of this pandemic?
Thank you very much, Irene, and hello to the rest of my panelists. So emergency department is perhaps the true definition of a front line for healthcare. And really that's because in the emergency department, we see a wide spectrum of undifferentiated patients. And specifically related to COVID, it's incredible how many different categories of pathology can present with difficulty in breathing, all the way from simple pain to heart failure to a patient with severe COVID. So over the past year, in Uganda, health workers in emergency departments have really gone through various stages. I know I have, and you try to balance between, you don't want to miss COVID diagnosis, but you also do not want to mislabel a patient as a COVID suspect, because once that happens, then nobody listens to reason anymore. For as long as, a patient is labeled with a C for COVID, the patient goes through a completely different pathway. And if you're wrong, then you'll have subjected a patient to a pathway that they not necessarily wouldn't have had to go through. And initially, we had a lot of anxiety a year ago, and that was in the early stages from 21st March when Uganda reported her first case. And a lot of it was largely inexperience and inadequate information. A lot of information and experience that time was shared from other countries, but gradually, as we managed our own patients, we got better. Our heart rates reduced significantly, and we got more comfortable with PPEs and managing patients. Of course, things like PPE challenges and overcrowding in emergency departments were challenging. They still are a challenge, and generally it is often safer to essentially work with a high index of suspicion for patients and work at mitigating challenges. We don't have X-rays, we can't move a very sick patient, and we've had to do things like introducing point of care ultrasound training for COVID, things which we hadn't necessarily thought of before, and also ensuring that even in emergency departments, we have clear isolation areas and have clear protocols for managing patients. And protocolized care with COVID has actually spilled over into managing of other patients because, you know, our concept of protocolized care is scientific and proven. And once we've seen that teams are doing it well with COVID, we've actually seen that the same approach has helped improve care for other pathologies. Thank you, Irene.
Thank you. I'm glad to know that the heart rate has gone down now, and that at least we've got an opportunity to improve our response to emergencies. So thank you for that, and thank you to all your colleagues. Harriet, Miss Harriet, we know that you are the director for the Milk Court. From your experience, what has it been like for you and for the girls and the young people that you serve in your community?
Thank you very much, Irene. Thank you very much, City Global Health. And thank you very much, Access Challenge, for this great opportunity. And thank you for the great introduction that you made. Once again, I'm leading a community-based organization called Midwife-Led Community Transformation, which is aiming at bridging the gap which exists between the midwife and rights to marginalize adolescents and young adults in the communities of Nansa and municipality. How has been my experience as a midwife in the community during the COVID-19 pandemic? Well, before the pandemic, I and my team, we could reach out to these marginalized adolescents to provide them with the information through the health education talks, and we could make gatherings in the communities, and also they could come here because we also, at the center, because we also provide other programs like vocational skilling and empowerment programs. When the pandemic came in, even the population came among the marginalized communities of the young people because they used to depend on hand to mouth, and during the lockdown, they couldn't get access to anything. It was entirely hard for them to get what to eat, or even to prioritize buying a mask for themselves. And also us at Milk Court, I myself, because of the limited resources, it was entirely hard for us to continue reaching out to them through the available means. So we could only call them via phone to provide counseling because they have been going through a lot of challenges, especially sexual reproductive health challenges, sexual violence, poverty, of course, and many others. With the little funding that we got, pads, and also provided them with the sexual reproductive health information. Not enough. The pandemic has continued to depress these adolescents and young adults, and many of them have got mental health challenges, including depression and stress. So it has been a challenge for them and they need help. And when it came to access to the vaccine, it is entirely hard for them because of the misinformation that is moving around communities. I'm sure we shall discuss more about that. Thank you very much.
Thank you, Harriet. In other words, what I get from you is that aside from the pandemic, the young girls and young people have got so many challenges that have come in. Some were there before, but they've been amplified by the pandemic. Thank you, Harriet, for sharing that. Dr. Annette, we've heard from the Minister of Health, Honorable Dr. Kuduku, on the national response to COVID-19 in Uganda and what we are trying to do as a country to address the challenges of vaccine hesitancy. From your perspective, what can we as health workers do to contribute to this fight, and also address the challenges to vaccine hesitancy, and also what can we learn from this to ensure that we use all these lessons learned into the community and the general population.
Thank you very much, Irene, again, for that excellent question. You see, Irene, as health workers, we're generally a very lucky profession. So the public holds us generally, and I will stress generally, in high esteem. But also, we as a profession are uniquely placed to instantly give credibility to many things that happen in our society. But with COVID has been a bit unique. So with COVID, we faced a lot of challenges, specifically misinformation, which has bred mistrust from the public. And this therefore calls for us as health workers to have a shift in our mindset from what we are traditionally used to do. As I say, we always give patients instructions and have to comply. We have to move to a do as I do type of approach. And I'll give you an example. In 2019, when the country was grappling with a similar issue with the MMR vaccine, and there were challenges of uptake, and even people who had vaccinated their own children were struggling to take them for an MMR booster. There's just one single picture on the front page of newspapers. It circulated on social media. And this was a picture of the Honorable Minister of Health, Dr. Jane Ruth Acheng, having her daughter, her primary school doctor, receiving the MMR vaccine. That single picture literally turned the tide for the country. And after her, when we saw, other doctors, pediatricians who are held in high esteem in the country doing the same, it changed. And so for the minister, she was in that instant, not just a minister giving directives, but a mother having her child vaccinated and speaking to fellow mothers. And so health workers, I think we should adopt a similar approach. We should be, as the public, we should take ourselves out from those shoes and get ourselves in the shoes of the public. We should reinforce government messages. We should at all opportunities counter lies with scientific facts. And there's a lot of factual information on the internet from WHO and all the CDC and other credible websites. But we should also get the vaccine ourselves, and we should essentially walk the talk. And in doing that, I think we'll restore a lot of the mistrust that the country has. Not just the country, it's actually a global issue, because vaccine hesitancy is a huge challenge, and we must address it at all levels. As health workers, our unique role means we are in a unique place to address it in a unique way. Thank you, Irene.
Thank you. What I get from you is that we need to act as examples. I'm very sure that some of our health workers have also not yet got the vaccine. So if people see us out there, then they'll be able to believe and say, if my doctor, if my nurse can do this, then I can also get it. Thank you so much, Dr. Annette. Ms. Harriet, what has been, you slightly touched on it earlier, but can you elaborate more on the effects of the pandemic on maternal, child, and reproductive health for the people that you serve in your community?
Thank you very much, Irene. Yes, when we look at maternal and child health, and when we have to go back to the maternal mortality rate, which was 336 deaths per 100,000 live births. And now, during the pandemic, according to the current statistics of UNICEF, it has now gone over 400 deaths per 100,000 live births. And this is quite a big change that we need to look at as we are fighting COVID-19. So one of the challenge, according to my perspective as a midwife in the community, when the pandemic came, the women could not access the health services easily. And so they could get retained in the communities and In this case, we are looking mainly at family planning. It has been a very big challenge for them to access family planning, and they have ended up getting unintended pregnancies. So that means when women are pregnant and they cannot even access antenatal services, and that impacts a lot of healthy challenges on the outcomes of the babies in the hospitals. And when we look at the young mothers whom we support at Milcourt, they've got unintended pregnancies, and what they see as a solution is definitely abortion, and they have been getting challenges and hiding in silence. So is the hard to access sexual reproductive healthy services by women, and this has affected mainly these marginalized adolescents and young adults, because they even don't have money to go to the private healthy facilities. They are there only waiting for someone who can help. Just of recent, we have been running our project, Nightingale Challenge Project, where we have been training nurses and midwives in our lower level healthcare facilities on provision of adolescent-friendly healthy services, but also empowering them in leadership, and of course, giving them information and skills on COVID-19. So what we have done, we have also gone ahead to the communities and provided adolescent-friendly sexual reproductive healthy services, and we have seen a high turn-up of adolescents and young adults coming for family planning. So that means we need where they can easily be accessed, because the effects of the pandemic can no longer allow the grassroots people to go to the facilities. Those are some of the challenges of the pandemic on sexual reproductive health.
Thank you, Harriet, for sharing that perspective, and thank you to you and all your colleagues for the work you're doing to ensure these services get to the community. Dr. Samson Redenyo, welcome. We are pleased to have you. I would like to give you the opportunity to share with us. Rwanda has been recognized as one of the countries that has been successful in rolling out the COVID-19 vaccine and also addressing vaccine hesitancy. From your perspective, what do you think Rwanda got right, and what can we learn from that experience that you can take to our communities and countries?
Thank you so much, Harriet, for this question. Indeed, Rwanda is a shining example to the world in many ways, not just management of COVID-19 pandemic. The country has been very successful over the years in reducing newborn and maternal mortality, reducing incidents of malnutrition, and increasing the uptake of family planning. So those are just a couple of successes that Rwanda has recorded over the years. I think there are many lessons that the world can learn from Rwanda, not just in vaccine rollout, but even more importantly in epidemic preparedness and control. Even before the first case of COVID-19 was reported in Rwanda, the country had already started preparing and was able to put in place a robust COVID-19 preparedness and control plan rapidly. The plan was subsequently updated to include vaccine rollout. Having in place and following a robust preparedness and control and vaccine rollout plan is a critical imperative in handling the COVID-19 pandemic. The strict adherence to the preparedness and control and vaccine rollout plan is to a large extent attributable to Rwanda's success in this area. This is something that I think that the world can learn from Rwanda. Rwandan government knows how critically important it is to engage stakeholders, such as the civil society, development partners, religious and faith communities, and others. The government mobilized stakeholders to support the work outlined in the preparedness and control plan. that's how the government was able to mobilize resources to support construction and or renovation of isolation centers, procurement of essential PPE, training of health providers, deployment of contact tracers. So the lesson, I think, the world government to inspire public confidence and addressing vaccine hesitancy. Rwanda made clear and consistent messages about leaders at all levels to support dissemination. These messages were simple, clear. In Rwanda, is quite minimal. So I think these are some of the lessons that the world can learn from Rwanda's experience. Back to you, Irene.
Thank you so much, Dr. Radeni. What a wonderful way to close this discussion. I wish we had all the time to get into everything we wanted to discuss. What I take from you is that public confidence is very important, and using stakeholders that the public trust, for example, the religious leaders. I think that is something that we can learn in our communities, in our countries. Thank you so much, Dr. Radeni, for sharing that. And thank you to our panelists, Ms. Harriet and Dr. Annette Alenyo. I'm very grateful for your time to be here and share with us your knowledge, your expertise, and your wisdom. Thank you so much. And thank you to our listeners. I hope you enjoyed the discussion as much as I did. I hand over to Dr. Vanessa to take us into the next discussion. Thank you.
Thank you so much, Irene, and to all of our panelists for joining that conversation and leading us through that very important discussion. I would like to shift the conversation now to look at this from a different angle and to ask for two deeply accomplished and exemplary global health and leaders and vaccine equity advocates to speak with us for a moment. They are both very well poised to respond to the challenges and needs that have been presented in the prior discussion. And they will hopefully help frame the solutions that we can enact together at a broader level of around vaccine production, distribution, and the needs to address COVID-19 vaccine hesitancy and misinformation. So I'd like to briefly introduce our discussants who have joined us today. We are very privileged to have the Nobel laureate, Professor Muhammad Yunus, who is the father of both social business and microcredit and the founder of the Grameen Bank and of more than 50 other companies in Bangladesh. For his constant innovation and enterprise, the Fortune magazine named Professor Yunus in March 2012 as one of the, quote, greatest entrepreneurs of our time. In 2006, Professor Yunus and the Grameen Bank were jointly awarded the Nobel Peace Prize, and he is the recipient of over 61 honorary degrees from universities around 24 countries. He's received 136 awards from 33 countries, including state honors from 10. And he's one of only 7 individuals to have received the Nobel Peace Prize, the United States Presidential Medal of Freedom, and the United States Congressional Gold Medal, which I just speak of as coming from my home country, just how much we appreciate the leadership and vision you have created for the world. I also would like to introduce the Honorable Minister, Dr. Austin Denby, who is the Minister of Health and Sanitation in Sierra Leone. He was recently appointed in 2021. Honorable Minister Denby was previously the Deputy Director of the US HRSA's Office of Global Health. And he was also the Director of the Principal for the President's Emergency Plan for AIDS Relief, or otherwise known as PEPFAR, where he headed the department's $2 billion global HIV/AIDS portfolio. Honorable Minister Denby is an epidemiologist and a virologist, and he has worked earlier on Sierra Leone's Lassa fever project in the eastern region. He led the US response during the 2014 Ebola outbreak in the country. And as the new health minister, his ministry's vision is to ensure a functional national health service delivery for high quality healthcare services, which are accessible, equitable, affordable for everybody in Sierra Leone. So I want to just also say, I know we're running a bit behind time for everybody who has joined us today. We will go a little bit over today, but we will plan to end by 10:15, and we have some very powerful speakers who will be joining us, including Dr. Ahmed from the Africa CDC. So I ask you all please to stay with us. I would like to start, please, with a question for Professor Yunus. Professor Yunus, you have served as a commissioner on the United Nations High-Level Commission on Health, Employment, and Economic Growth, which speaks very much to the integration between health for our well-being, for our economic growth, for job creation, for helping to create equity. And the Commission has been tasked with identifying actions to stimulate the creation of health and social sector jobs as a means to advance inclusive economic growth. We've heard from national leaders, health workers earlier today on the challenges they face on front lines and national levels. And I was hoping that you could please share with us insight of global conversations and how the Commission is thinking about protecting, improving, and scaling health workforce in lower and middle income countries, and how maybe have the plans of the Commission been altered, changed, or really invigorated since the pandemic hit.
Well, thank you. Thank you, Vanessa, for inviting me. And this is a wonderful discussion that you have. From my side, I'm not a healthcare professional. I got into it in a roundabout way. My focus always has been with the poor people and seeing what can be done to improve the situation of their poverty. And that led me to do something related to financial system, so providing microcredit to poor people. And then created a bank to do that. So gradually I got involved with the healthcare because if you are poor poor in health. And particularly if you're a poor woman, it's an extreme case of health situation. And I was focusing on poor women. So I got involved with the health issues and so on. So healthcare, and then debate came whether healthcare means health of the poor people means have more hospitals, more doctors, more nurses, and so on, which is the usual thing that you have to provide. And that's what all the discussions that all the commissions talk about. So I brought this subject in a different way, not from the healthcare side. I said the most important thing for the poor people for their healthcare is food. If you cannot provide the food, forget about other healthcare providing and so on. So the food and sanitation became my first interest in the poor people and how to make that happen with the food. So from the food, gradually, I said the food is possible. You cannot just distribute food for people. You have to generate the income for people. So how to bring income to the people. So the one thing led to the other. And from income, I got into the issue of entrepreneurship. And that's what the microcredit is all about, how finance got involved in it. So this is the scenario that I have been following. And I was claiming that all human beings are born as entrepreneur, not as job seeker, which is the wrong direction that society has been giving us. I said, if we had addressed them as someone entrepreneur, I said, that's why we are born as an entrepreneur. All human history tells us that when we are hunters and gatherers, we were solving our own thing. We are getting things done for ourselves. We are not looking for a job. When we are in the caves, we are not sending job applications. We are solving the problems. So I said the entrepreneurship is inside of all of us, but job has pushed us from that and took away our creative energy and all the other things. So how to make that happen? That the finance comes in. And when we come to the finance, we have the financial system. That's where our focus became interested. And they were telling the financial system, telling us it cannot be done. So we had to redesign the system, which can be done. And so we reversed it. It's a kind of reverse process of the existing banking system. And that led us to the inequality of the system, how financial system leads to extreme wealth concentration. All the wealth of the people are concentrated in fewer and fewer hands. So I said that system has to be reversed. So when you come to the pandemic issue, and I've been talking right from the pandemic, beginning of the pandemic, I was saying this is a great opportunity for us to redesign the system because the system has collapsed. So this we should take a challenge to redesign the system so that we do not follow the old way of doing things. We redesign, rethink, reinstitute everything that we have. Instead of looking at people as a job seeker, we look at as an entrepreneur. And instead of seeing that the people are looking for food for survival, you look at concentrate on the income of the people and so on. So, and the pandemic has also shown how many millions, even billions of people have been pushed below the poverty line in one just go. So how to make sure that we can reverse the system, pull the people out of that system. This is the right time to make that happen. That's what took us to the vaccine. And you mentioned about the vaccine, that how vaccine has been so focused on the rich countries and the rich people. We are talking about the vaccine apartheid. And I was talking about the patent-free vaccines so that everybody can afford it. Everybody can be, it could be produced worldwide. So that's what we're working on. Thank you very much.
Thank you, Professor. And you know that we are, I'm a deep advocate for vaccine access globally and been grateful for your leadership on that topic. And I think it's interesting to hear you speak about this idea of everybody sort of, of rebuilding a system or doing it differently, right? How can we take this moment and think about how can we sort of engage in our world and solving these problems in a different way and redesign the system? And Honorable Minister Dembi, I'd like to ask you a little bit about that. You have been in a number of positions. You've worked at PEPFAR, you've done Lassa fever, you led the Ebola response. And I would love to hear from you. What are some of the lessons learned from responding to those different experiences that we can apply to respond differently in COVID in this moment and to do things differently now?
Thank you very much, Vanessa, and thanks for a great panel. I think for me, it's looking at health in a country like Sierra Leone is a good example, not as a service in itself, but as a real investment. And I was attracted to come back home to Sierra Leone because of the president's vision of development. And what he is saying is, even though we have all of these options for development, why don't we really invest in the human and invest in human capital development? And what he did was narrow that focus on 4 focal areas, even as you look at things much more broadly. But he was saying, let's invest in education, in a broad scope education, such that the person is able to understand themselves and their surroundings, is able to innovate, it's able to create, it's able to be a master of their environment. And as you do that for a population of about 7 million people, let's make sure that we could have a healthy population as well. So investing in health, such that you have a healthy, educated population. And thirdly, to invest in food security and ensuring that people who are smart, educated, who are healthy, also have food security. And then you have the infrastructure that glues all of these pieces together. So I am much more interested in the education sector and how do you convert this into a real investment. And what we're looking at here in Sierra Leone is not focusing on specific diseases per se, but looking at life stages from the pregnant woman all the way to what services you need to provide to them before pregnancy, during pregnancy, at labor and delivery, and post-delivery. And at the end of that, with a healthy baby, how do you make sure that that baby thrives? And what are the health factors and what are the interventions and what are the structures that you build around that baby? All the way into going to school, into primary school, into secondary school, into adults, into senior citizens. And you disaggregate it from the males and the females, the gender lens for the life stages. And I think that's what we're working on in Sierra Leone, to make sure that we put all of our interventions in these different life stages with specific targets, with specific outcomes, with specific geographic focus as we engage in this. So you can imagine with all of these plans, you have superimposed on it COVID that really disrupts the whole rhythm that we're trying to attain here. And how do you respond to COVID while still maintaining this complete cycle of health support for the country? I think for us in Sierra Leone, it's a lesson we could all learn from ourselves and from other countries. We want to be sure that as we look at these critical elements, if you're looking at vaccines as a remedy for COVID-19, one of the things that we learned from Ebola is the fact that you really have to engage the public and bring the public along. So we found out very early in that Ebola response that it is important for the healthcare worker, who is the most believable in the opinion of the public, to deliver health messages. It's important that the healthcare worker listens really well to the public, and ensures that no question is too simple, no question is irrelevant, but to really take it very, very seriously and convert your actions towards responding to their needs. And what we found out was that in the context of Sierra Leone, people were saying, first, we have deep skepticism around these vaccines that you're bringing to us. We don't know what they are. All of a sudden, you hear blood clots are happening somewhere. We're afraid that we might be glowing. It's like a fertility thing that you want to do with us. So it's important to hear those and understand what their concerns are. Some of it is personal. Some of it is around their family. Some of it is outright skepticism. So how do you respond to all of those, and make sure that the messages do respond to their needs? And following that, you want to be sure, in Sierra Leone's context, is that if you believe in these vaccines so much, why don't you take it yourself? Why don't your president take it himself? So we made a whole spectacle of having the president stand in public and take the vaccine, and all of the cabinet ministers take the vaccine in the public space, and all of the opposition leaders come take it in the public space. And the second concern is, what are the adverse events associated with this? And we put in place a system and a structure with clear transparency to say we will monitor everybody that's vaccinated, and if there's any adverse event, we'll make sure that we address it as soon as possible. And now with over 80,000 people vaccinated, they've seen no adverse events. Our challenge now is, how do we resupply vaccines? And since we've created this huge demand, people are interested, people want the vaccines now, we're not sure if we're going to be able to get enough resupplies to be able to meet their needs. That's our challenge. Over.
Thank you very much for those comments and for really addressing, I think, one of the real challenges is hesitancy, but I think that at the end of the day, there is just not enough vaccine, available for this world. And the way it's been dispersed has been, I think, unfair, not equitable, and it's not protecting everybody's best interest. The vice president said, no one is safe until we are all safe. And so, Professor Yunus, you have been really championing through public advocacy. You issued a very poignant letter bringing together Nobel laureates and heads of state to really advocate for the need for a people's vaccine. You've been championing this incredibly important movement to create equity about how we think about the vaccine and not make it a commodity and use vaccine apartheid, as you eloquently use. And I'm going to ask you a very difficult question that I would love to get your insights from, because you have been challenging world leaders for a long time to think differently and to think about what is possible if we put our mind to it and we get creative and we invest in that human capital and that entrepreneurship. What can we do to make our leaders of today think differently, think equitably, think about who we are as humans and what that means to create that well-being and to close these profound inequity gaps we can do today? I'd love to hear from you about what it is we can do to help create that meaningful change among those that do hold the levers of power that affect so many who need to be protected.
Well, the leaders come from a political system. So a political system is something that has to be activated. Where we saw, particularly on the environment side, when the young people got active on that issue, people got into more on the political side inside of it, because this young generation is coming up, and the young generation is blaming their older generation, their parents, saying that you are stealing our future. You have already stolen our future. And they came up with this Fridays for Future campaign. And that has a tremendous impact in the political process and so on. So I would say it's changing the minds of the young people, but the older generation has contaminated minds. They are seeing things in a different way, wrong way. It needs a fresh eyes, fresh minds of the young people, how to see things in the way as it is. People don't see these problems like wealth concentration. This was very active in the US campaign, a presidential campaign, with Bernie Sanders was talking about how wealth within the US is concentrated in fewer hands. And absurd information he was giving to the people. But it didn't pay, it didn't get put into the political system as such. But it made young people got activated into that, how to address that issue. So I would say it's activating the young people to see the world is different than what we are told. It can be seen in a different way, and how to make that counter knowledge of doing things and seeing things, and examples are very important. And we have created lots of examples. For example, it's a social business issue that I keep talking about. And when we come to the vaccine, after seeing all the ugly things about the vaccine, where only the 3 largest vaccine pharmaceutical companies declaring their dividends, $26 billion, the same period when the vaccines are being produced. So they're celebrating their enormous amount of profit out of the life of the people who have been denied access to life and so on. I was even telling that the people are drowning in the pandemic, and some people have the boats. They created the boats and offering to the best, the highest bidder. If you can give it the highest money, you can get into the boat. Otherwise, you go and die. So life versus profit, that tension. I said that tension can be overcome. Only we have to do is to create social business pharmaceutical company, not the profit maximizing pharmaceutical company, but the social business pharmaceutical company. By social business, we mean non-dividend companies to solve human problems. These are the range of things that we have done both in Bangladesh and many other countries to create businesses to solve people's problems as a social business. And it's coming up. And it's a good area where today to take that challenge to create social business venture pharmaceutical companies, so that you don't produce vaccines to make money. You produce vaccines to reach out to people, like Sierra Leone was just mentioning that they have only done 83,000 people out of millions of people, perhaps, they were waiting for that. What a shame when a few countries will be vaccinating everybody and the rest of the world will not have any vaccination at all, because one decision, that if you had just taken away the patent right, like I want to thank you and President Biden for supporting this idea, or even temporary waiver of patent right. That's a key thing. Then everybody can produce it. Bangladesh could produce it, Thailand could produce it, I'm sure all over Africa can produce it, and many other countries can produce it. Brazil can produce it, Mexico can produce it, anybody can produce it. Then it will be distributed production for distributed global distribution of vaccines. That's the important thing that I see is coming up right now.
I mean, I'm completely in agreement about the need to expand access to all places, to increase access. And I think it's a painful time to see the way decisions are being made at the current moment. We never have enough time for panels, especially with 2 people as esteemed as you. But I do have one more question, please, for you, Honorable Minister Dembi. I mean, from your position as the Minister of Health and Sanitation in Sierra Leone, you have the job now to convince many international partners and others to help you rebuild the health system in your country. You have the vision, you need but there's resources and support and the ability to make these upfront investments. I'd love to know from you, how do we move and mobilize those other leaders in their political systems, in their mandates, to see the vision and the possibility for your country? How is it that we can use examples from the past or help create that change so that there is solidarity and investment and vaccines and infrastructure and to allow you to make those investments in health that your government seeks as a path forward for the country?
Well, thanks for this. I mean, just to backpedal just 1 minute. When you see what's going on around the world, the fact that others are dictating when Africa gets vaccines or how many doses they get at any point in time, I think those are symptoms of a fundamental issue. So Africa's ability to make our own drugs, make our own vaccines. And I think there's a concerted effort right now. There's the African Medicines Regulatory Agency that's been put together. Initially, that people thought that the Africa CDC would not work. And I think we've seen how effective the Africa CDC has been. We want to be able to do something similar in the regulatory space around medicines and vaccines and drug productions. I think in the Sierra Leone context, what I'm looking for is to make a clear business case for why it's worth investing in a country like Sierra Leone, investing in health, and seeing what has been lost by not investing enough in our health sector. I think the need it's insurmountable at this point, but it should not be driven by sympathy and empathy. I think it should be really driven by what is good. And I think Sierra Leone really ought to take the leadership in convening friends and convening the right people around to just say, what do we need to do to transform the health situation in Sierra Leone? And what I'm doing right now is pulling all of that together. So when you convene partners, you're able to say, this is what we're thinking of, this is where we're going, and we would like for you to be a partner with us as we transform the health sector in Sierra Leone across multiple domains.
Well, thank you. I mean, we are so delighted to be in partnership with Sierra Leone, all of us at Seed Global Health. And I think we agree. We want to start to change the narrative, right? We want to show how we can be transformative through health for well-being, through social entrepreneurship, through business, to link the well-being of people going forward. I'm incredibly grateful for both of your time, for both of your leadership, for the continued advocacy, fight, examples, evidence you are bringing forward. And I'm really grateful that you were able to join us this morning. And I apologize that we do not have more time, but I am also delighted to introduce our final speaker, Dr. Ahmed, who is the Deputy Director at the Africa CDC. He's an accomplished international civil servant, an expert in global health, and has really been providing critical leadership in governance and public health, partnerships and resource mobilization, health security, including health emergencies, prevention of and control of NCDs, multi-sectoral partnerships, international collaboration, leadership against tobacco control, global health diplomacy. The list goes on. But I'm incredibly grateful for his advocacy in this moment around access to vaccines, vaccine hesitancy, and helping to really push this world to think differently about how we can get everybody safely vaccinated and on the other side of this pandemic. Dr. Ahmed, we are deeply honored to have you this morning, and thank you for closing today's event.
Thank you very much, Vanessa, for that very generous introduction. And good morning, good afternoon, good evening, wherever we are. It's a pleasure to join this session today, talking about something that is so contemporary and yet also so sad a topic for us, particularly in Africa during this time. So it is indeed my pleasure, and I bring greetings from Africa CDC out of Addis Ababa here in Ethiopia. And I really have three messages today. The first is the best time. Some wise person once said that the best time to plant a tree was 20 years ago, and the second best time to plant a tree is today. And really today, we have enough information and motivation to be able to plant the tree of equity, particularly when we talk about vaccines for a pandemic. And everyone out there who has any ounce of care for humanity would see that we cannot be able to succeed in bringing the pandemic to a stop unless we act together, unless we ensure that all who need it have access to vaccines, and unless we start seeing ourselves as part of the same global family. Now, the second thing I would like to share as we close this session today is that safety in health security is completely based on the safety of your neighbor and the safety of your neighboring country, your neighboring continent. All of us have to be safe for each one of us to be safe. And that safety cannot be able to be achieved when some parts of the world, particularly in Africa, do not have adequate access to vaccines, therapies, and other health products that we need to be able to break the back of this pandemic, while other parts of the world have not only access, but indeed have started showing signs of even misusing what they have by giving people who don't really need it, while those who truly, truly need it in parts of Africa and yet to be able to get this vaccine. So that equity call needs to enter each and everyone's heart so that we get the vaccines that we need. Finally, is to say that there is no way we can be able to achieve a secure globe if any part of the globe is not secured. And health security is as important in Africa as it is in any other part of the world. And the only way that we as Africa can be able to contribute to the health security of the world is by us standing on our own 2 feet so that we can be able to drive our new public health order in a way that befits the African continent. And the 2 very important things need to be remembered when we talk about the new public health order. The first is Africa needs to build its own capacity, whether it is workforce development, whether it is infrastructure, whether it is knowledge base and evidence generation, whether it is research and development. Africa needs to build its own capacity internally. The second is respectful and action-oriented partnerships. Partnerships that are going to address our true priorities on the continent is what we would like to see in Africa. Partnerships that are going to ensure that sustainability is built into each and every action that we take on the continent in health security. Partnership that is going to respect the fact that Africa may not have the adequate resources to be able to do some of the R&D and vaccine development activities that are required, but Africa is motivated by the fact that it must drive its own agenda. These types of partnerships are the ones that we want on the continent and are the ones that we are going to encourage, and they are the ones that we are going to build so that we are able to deliver on the mandate that has been given to Africa CDC by the African heads of state. So we are only as safe as our neighbor is safe, and the world is only as safe as Africa is going to be safe. Vaccines are a public health good, and they must be equitably distributed for us to be able to break the back of this pandemic. If that does not happen, more variants are going to pop up, and God forbid that some of those variants will be able to escape the current vaccines that we have, because then the world will start spiraling down another round of a pandemic and more waves of pain and deaths. And we can't be able to avoid that by doing 3 things. One is vaccines that are being produced today, let them be equitably available throughout the world. Second is those who are holding patents and licenses, release those, even if it is temporarily, release them so that we can be able to manufacture more vaccines to ensure that we get to herd immunity as fast as possible across the globe. And 3 is for me and you as members of the public to continue to respect public health measures, because our responsibilities and our discipline is what is going to ensure that we succeed in keeping at bay this pandemic, even as we wait for the vaccines to be able to be made available. I thank you for the opportunity to speak at this closing session. Excellent discussion that I've had there from Minister Ndembi and Professor from Bangladesh. And I really hope that the messages that they have given today are going to be heard in all corners of this earth that we share. I thank you, and it is my pleasure to be able to represent Africa CDC at this closing session. Thank you.